Hi, in this presentation, I will talk about mental illness. So here we will be talking about causes of mental illness, some of the mental illnesses which are commonly undiagnosed or they take a very long time to be diagnosed, and some of the myths and facts associated with mental illness. So what is mental illness? A mental illness is a medical condition that disrupts a person's thinking, feeling, mood, ability to relate to others, and daily functioning. Or, in much simpler terms, we can say mental illness or mental disorder is a wide range of condition that can affect mood, thinking, and behavior. So, just as diabetes is a disorder of the pancreas, mental illnesses are medical conditions that often result in a diminished capacity for coping with the ordinary demands of life. So, just like diabetes affects pancreas, mental illnesses affect the mind of a person. So, 1 in 5 adults in the United States they experience mental illness each year. And 50% of all lifetime mental illness begins by the age of 14, and 75% of lifetime mental illnesses they begin by the age of 24. And 1 in 25 of every adult in the United States experience serious mental illness each year. So, a mental health condition or a mental illness isn't the result of one event. So, research suggests that there is multiple causes of it. Some of the serious mental illnesses include major depression, schizophrenia, bipolar disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and borderline personality disorder. But one good news about mental illnesses is that recovery is possible. Mental illnesses can affect persons of any age, race, religion, or income. Mental illnesses are not the result of personal weakness, lack of character, or poor upbringing, and mental illnesses are treatable. Most people diagnosed with a serious mental illness can experience relief from their symptoms by actively participating in an individual treatment plan. The causes of mental disorders are generally complex and vary depending on the particular disorder and the individual. Although the causes of some mental disorders are unknown, it has been found that different biological, psychological, and environmental factors can all contribute to the development or progression of mental disorders. Most mental disorders are a result of a combination of several different factors rather than just a single factor. Now let's talk about the causes of mental disorders. The first cause of mental illness are the biological causes. These biological causes can range from biochemical disturbances, genetics, infections, brain defects or injury, prenatal damage, poor nutrition, and exposure to toxins. So there are a lot of mental illnesses that are hereditary. Some of the examples are schizophrenia and Alzheimer's. Research has shown that many conditions or many mental illnesses are polygenic, meaning that there are multiple defective genes rather than only one that is responsible for a particular disorder. But the reliable identification of specific genetic susceptibility to particular disorders through linkage or association has been proven very difficult. So this has been reported to be likely due to the complexity of interactions between genes, environmental events, and early development, or to the need for new research strategies. A number of psychiatric disorders have also been linked to infections which can cause brain damage. And for example, there has been some findings of link between infection by the parasite Toxoplasma gondii and human mental disorders such as schizophrenia. Poor general health has been found with among individuals who have severe mental illnesses. So researchers have also shown that infections and exposure to toxins such as HIV and streptococcus can cause dementia and OCD. The infections or toxins trigger a change in the brain chemistry, which can develop into mental disorder. Any damage or injury to the brain, for example, traumatic brain injury, it can cause mood disorder, psychotic disorder, and substance abuse. So there have been studies which have found a relationship between TBI severity, TBI means traumatic brain injury, and the prevalence of subsequent psychiatric disorder. Brain tumors can also cause certain types of dementia. Next is prenatal damage. So any damage that occurs to a fetus while it is still in its mother's womb is considered prenatal damage. So if the pregnant mother uses drugs or alcohol or is exposed to illnesses or infections, then mental disorders can develop in the fetus. So according to research, certain conditions such as autism result from disruption of early fetal brain progression. So environmental events surrounding pregnancy and birth have been linked to an increased development of mental illness in offsprings. So this include maternal exposure to serious psychological stress or trauma or obstetric birth complications, infections, and gestational exposure to drugs like alcohol or cocaine. Now, some of the biochemical disturbances like abnormal levels of dopamine activity has been related with number of disorders, for example, ADHD and OCD where dopamine is reduced, and schizophrenia where the level of dopamine is actually high. Dysfunction in serotonin and other monoamine neurotransmitters like norepinephrine and dopamine are also associated with depression, OCD, phobias, PTSD, generalized anxiety disorder, etc. Now let's talk about the psychological causes of mental illnesses. So severe psychological trauma suffered as a child, such as emotional, physical, or sexual abuse, an important early loss such as loss of a parent, neglect, poor ability to relate to others, all these can lead to mental illness in the future. The next cause is environmental factors. So the term environment is very loosely defined when it comes to mental illness. So unlike biological and psychological causes, environmental causes are stressors that the individuals deal with in everyday life. So some of the environmental factors which we can deal in, which sometimes we have to face in our day-to-day life, are like death or divorce, a dysfunctional family life, living in poverty, feelings of inadequacy, low self-esteem, anxiety, anger or loneliness, changing jobs or school, social or cultural expectations. For example, there's a society that associates beauty with thinness or beauty with fair skin. It can be a factor in the development of eating disorder. Substance abuse by the person or the person's parents. Stress in general can also cause mental disorder. These stress can be academic stress, homesickness, poor relationships, family stress for identity, work, and illness. Now let's talk about some of the commonly undiagnosed mental illnesses, or some of the mental illnesses which take a very long time to be diagnosed. So the first one of these is depression. So depression is more than just sadness. We all sometime or the other say, oh, I'm just depressed. But depression is much more than that. Depression has a bigger meaning. It is not the stress that we face in day-to-day life and we become sad. Depression is much more than our day-to-day stress. So people with depression may experience a lack of interest and pleasure in daily activities, significant weight loss or gain, insomnia or excessive sleeping, lack of energy, inability to concentrate, feelings of worthlessness or excessive guilt, and recurrent thoughts of death or suicide. The next mental illness is panic disorder. So panic attacks are sudden, intense waves of fear. The attack involves several intense physical signs of anxiety, including racing heart, shortness of breath, dizziness, numbness or tingling, trembling, stomach upset, and hot flashes. During a panic attack, the person often feels afraid that they might die or go crazy. Next is delusional disorder. Delusional disorder refers to a condition associated with one or more non-bizarre delusions of thinking, such as expressing beliefs that occur in real life, such as being poisoned, being stalked, being loved or deceived, or having an illness, provided no other symptoms of schizophrenia are exhibited. So what are delusions? Delusions are false and fixed beliefs which are not according or in accordance with the social norms or the norms of the society. So in schizophrenia, delusions happen, but they are the part of schizophrenia. If delusion occurs on its own without the symptoms of schizophrenia, then it will be called as delusional disorder. So some of the common delusions are paranoia, delusion of love, delusion of infidelity, grandiosity, nihilistic delusion, etc. So delusions may seem believable at face value and patients may appear normal as long as an outsider does not touch upon their delusional theme. So as I said earlier, delusional disorders or delusion is a false and fixed belief. However hard we try to convince the person that his delusions are not right, he will not believe it. So these are false and fixed belief. The next is substance use disorder, a disorder that is characterized by an individual's need for more of a drug or alcohol than intended, an ability to stop using by choice, and an ongoing difficulty in recovering from the effects of the substance is called substance use disorder. Now let's talk about some of the common myths and facts associated with mental illnesses. The first myth is mental illness is rare. The fact is, mental illnesses are more common than cancer, diabetes, or heart disease. 1 in every 5 families is affected in their lifetime by a severe mental illness, such as bipolar disorder, schizophrenia, and major depression. The second common myth is psychiatric disorders or mental illnesses are not true medical illnesses like heart disease and diabetes. People who have mental illnesses are just crazy. The fact is, brain disorders like heart disease and diabetes are legitimate medical conditions. Research shows that there are genetic and biological causes for psychiatric disorder and they can be treated effectively just like any other medical problem. The third most common myth is depression and other illnesses such as anxiety disorder do not affect children or adolescents. Any problems they have are just a part of growing up. But this is so wrong. The fact is, children and adolescents can develop severe mental illnesses. Anyone talking about suicide should be taken very seriously, whether it is a child or adolescent or an adult. The next myth is addiction is a lifestyle choice and shows a lack of willpower. People with a substance abuse problem are morally weak or bad. The fact is, addiction is a disease that generally results from changes in brain chemistry. It has nothing to do with being a bad person. The next myth is electroconvulsive therapy, ECT, formerly known as shock treatment, is painful and inhuman. The fact is, ECT has given a new lease on life to many people who suffer from severe and debilitating depression. It is used when other treatments such as psychotherapy or medication fail or cannot be used. Patients who receive ECT are asleep and are under anesthesia, so they do not feel anything. In a lot of movies, ECT or the electroconvulsive therapy has been portrayed very, very wrongly, where they show that the patient is pinned down and there is a mouth gag and there are electrodes placed on the patient's head and they are not under anesthesia and they are given an electric shock, which is not at all what ECT is. ECT is done under a very safe environment under anesthesia, and it is a very, very safe procedure, and the effect of ECT are very fast. So it has proven to be a lifesaver in a lot of patients who have severe mental illnesses and they have treatment resistant or they have drug resistant mental illnesses, and when all the drugs fail, ECT has helped a lot of patients. Now let's talk about some common symptoms of mental illness. Recent social withdrawal and loss of interest in others. An unusual drop in functioning, especially at school or at work, such as quitting sports, failing in school, or difficulty performing familiar tasks. Problems with concentration, memory, or logical thought and speech that are hard to explain. Heightened sensitivity to sights, sounds, smells, or touch. Avoidance of overstimulating situations. Loss of initiative or desire to participate in any new activity. Apathy. Apathy means lack of emotions. A vague feeling of being disconnected from oneself or one's surrounding. A sense of unreality. Unusual or exaggerated beliefs about personal powers to understand meanings or influence events. Illogical or magical thinking, typical of childhood in an adult. Fear or suspiciousness of others or a strong nervous feeling, it's called paranoia. Uncharacteristic, peculiar behavior or bizarre behavior. Dramatic sleep and appetite changes or deterioration in personal hygiene. Rapid or dramatic shifts in feelings or mood swings. Suicidal thoughts or attempts and bizarrely violent or homicidal thoughts require immediate attention. But the thing that we have to keep in mind is one or two of these symptoms cannot predict a mental illness. But a person experiencing several together that are causing serious problem in his or her ability to study, to work, or relate to others should be seen by a mental health professional. Guidance counselors, teachers, or classmates are often the first to notice symptoms. But a lot of times when we read about a medical problem, we think, oh, I have this medical problem. But when we read about a psychiatric problems, we will be like, oh, this person has the psychiatric problem, but I don't have it. So when you read about medical illness, it's always about us. But when you read about psychiatric illness, you always identify someone who has at least one of those symptoms. So if at all there is someone who is experiencing these kinds of symptoms, at the very least, the affected person should have a diagnostic evaluation by a trained professional. Be educated about mental illness and signs and symptoms to watch for. Receive supportive counseling about daily life and strategies for stress management, and to be monitored closely for conditions requiring more intensive care like being suicidal. To conclude, mental health continues to be treated almost like an afterthought, which is very sad. There is a severe shortage of mental health professionals and facilities in India. So we, being health professionals, it is our responsibility to give health education to people regarding mental illnesses and remove the stigma from the society. Thank you. And if the videos and the presentations are helpful to you, please subscribe to my channel. Thank you.